look at a long bone, that should be all right there. Some of the basic terminology, right? Long bones are different from the other three classes of bones based on shape because, here's the tough one to remember, they're long. But ribs are flat bones and they're long also, so there's something else different as well. And we have expanded regions called heads. The anatomical term for a head is epiphysis. The anatomical term for the shaft is diaphysis. And we have one head that's closer to the main axis of the body than the other. That would be proximal, and the one that's further away is distal. Now, to allow for limb bones to form more stable joints, you'll notice how once we get to where they're going to articulate, the two long bones flare out dramatically in size. And those flares give more surface area for better articulation. Those structures are called condyles. In fact, this bone is broken, so I can take the condyles off. And you can see how less stable that would be for a joint than when we have all this surface area to work with. So we have our condyles. Then you see the term lateral versus medial, right? Medial means along the midline, lateral means the side. Well, here's the head. Here's the head of the femur. So our midline is right along here. So this condyle is medial, and this one is lateral. So see, once you learn, really get comfortable with this, you don't have to memorize, oh no, that's the medial condyle. You're like, oh yeah, flared structure that allows for better articulation. Oh, and it's along the midline of the body. Right, it's not memorization, it's recognition. You get to that point. Now, a term that some students have problems with in differentiating is condyle versus epicondyle. Epi again means on top, like epibranchial, right? So if we look at our condyle, which is all of this, we've got an elevation on it right here. And that elevation is the epicondyle. You'll notice the epicondyle doesn't attach to the other bone, where condyles do. Instead, it's an anchoring point for muscles and ligaments. So you have ligaments running from here to here to help hold your knee joint together. They're called collateral ligaments, which a couple of you probably know from injuries. These ligaments help to tie everything together. All right? So these are epicondyles. So on the medial condyle, we have a medial epicondyle. And on the lateral condyle, there's our elevation, right? So that's the lateral epicondyle. You can see that there, how it raises up to allow for more surface area for attachment. Now, one of the things you'll learn about in lecture is that the more you use your bones, your muscles, since your muscles attach to your bones, the more they're pulling on those bones, the larger those attachments get. So you can look at a skeleton and get an idea just how strong an animal was by looking at how big those bones are. You can also tell when you look at people. I know, isn't that embarrassing? Your last day of your life, you'll be exercising, hoping to leave a pumped skeleton. All right, I hope that helps.